welcome back, Dr. Heidi, for another Tuesday chat with you. We've got an interesting topic that we want to cover off today. They're known as a lot of things, really, but we want to talk about hotspots, which I feel like is quite a common name, or like, a very general use, because a lot of people I think would be like, oh, that's a hotspot. Probably isn't even a hotspot. So yeah, we want to pick your brain on hotspots today. And I guess the first question is, what is a hotspot?
So hotspots are also called wet eczema, or the
Wet
vet name
eczema.
for them is acute moist superficial dermatitis. So it's one of the most frustrating skin conditions for vets and owners, because they can suddenly appear and spread really, really quickly. So hotspots, wet eczema, all the same thing.
So I guess, how can I identify a hotspot, or how do I know it's actually a hotspot on a dog, like it's not just a red mark?
So common symptoms of hotspots would include things like you would see the skin being really inflamed or really,
Yeah.
really red. Often it's incredibly moist, so it can be sticky, it can be oozy, it can have quite a malodorous smell with it. Sometimes it's got a yellow sticky discharge, sometimes it can actually turn green if it gets a secondary staph or strep, but then Pseudomonas on top. So you can have a secondary bacterial overgrowth on top of the initial bug, kind of those two bugs work together. And then often the dog is self-traumaing themselves. So common sites in the dog you'll find wet eczema. I've treated two of these very severe cases in the last week. So on the ear, around the side and under the ear and on their neck, sometimes on the cheeks, sometimes on the base of their tail, around their hips or their tummy, sometime on the front of their foot, particularly on the carpus, sometimes under their collar, and then often in and under the underside of the ears. Those are all really common locations for wet eczema.
So, and is this just caused by, like, I'm going to take a real general assumption here. So, like you said, under the collar, it's like maybe they've gone for a swim in the river, the collar stayed on and it stayed wet, and then it's just like not being able to dry correctly, and it's just got a moist and sticky under there.
That's right. So
Kind of,
moisture trapped in the coat is really
yeah.
common, particularly in your thick coated breeds. So your retrievers, your Labradors, your double coated breeds, dogs that
Okay.
swim a lot. And then often if
Yeah.
it's very moist, like up in Auckland, the abrasion from the collar can actually trigger a hotspot. But there's other underlying causes as well of hotspots.
So yeah, let's dive more, because obviously I just think moisture, wet, we haven't dried it kind of feels like a human when you haven't dried under your toes correctly. But what are some other causes? What other causes for hotspots or
A
wet
really
eczema?
big one is a flea bite, as an
Flea.
initiating. Yeah, flea bite, flea allergy dermatitis can trigger a really severe allergic reaction because of the histamine release that occurs from the mast cells where the fleas bite through the skin. And then you've got a really overactive immune system going crazy. It's hot, it's red, it's itchy. And then, of course, the dog will scratch at that self-trauma, and you'll have massive mast cell degranulation with all that little histamine in the skin, and then you've got a big problem because it's itchy for 10 days. It's not such a big problem if the dog doesn't rip at it, but as soon as they've ripped all of that open, that histamine in the skin is really long lasting, which is why these horrible wet eczemas get out of control. So they can be the size of a golf ball or a $2 coin one day, and the size of a dinner plate the next.
Wow. So
Other common causes is things like the dog might have an allergy. So underlying causes for wet eczema, they've got environmental allergy or a food sensitivity, or they've had a contact irritant. Many of the dogs I see have ear disease as well. So that may be one ear, or it may actually be both ears, but the wet eczema or the hot spots under one ear. And those are incredibly painful and itchy for the dog. The dogs will often scratch at that at the side of their face and their neck, and then it creates this terrible, big, spreading, awful wet eczema around their head and their ears. It's incredibly painful. These dogs need pain relief. So often the first thing we'll do when we treat them in the clinic is give the dog pain relief, because they can be really, really thick, cellular, quite painful. So if a dog has pain in other areas of the body, particularly you'll see it in older Labradors, they'll actually lick over the point of arthritis on their carpus.
Yeah.
They're trying to soothe the joint pain, and then by doing that, they've abraded the skin, and then a secondary staph or strep, usually staph, pseudomonas, sometimes streptococcus, occasional Klebsiella will come along and hop on for a bit of fun, and they have these terrible big eczemas on their carpi, but those can
Yeah.
be treated quite successfully.
Okay. Awesome. Yeah. So I guess leading into my next question, which kind of feels like you've just explained it, which is why do dogs keep getting hot spots in the same place? It's because of the irritant or where the flea's been bitten. So the
Mm.
dog keeps itching in that area, don't they? And then it just keeps
Yep,
reoccurring.
that's right. And
Yeah.
and other underlying factors that are commonly missed by owners is things like arthritis.
Oh, okay.
You have to address the arthritis if the dog keeps getting a hot spot in that place. Some of the less delicate things as in around their derriere is they can have
Mm.
anal gland disease. So if they're
Yes.
hurting their bottom or chewing down around trying to get to a blocked anal gland, or maybe there's something that's infected in there, they'll get these terrible big wet eczemas in and around their tail. Um, a lot of orthopedic pain is an underlying cause for wet eczema, superficial dermatitis, and also nerve pain, neurological pain. So think of sciatica, so
Yeah.
pain down the back, whipping around that sciatic nerve, down the top of the hip, down the back side of the leg, and tingling in the legs. Those dogs will chew a wet eczema as well.
And
So
that create, yeah. So they're making it moist. They're like that nerve sensations, creating that hot spot for
exactly,
them because they're just
exactly. And
they're
like we
doing it
discussed
themselves.
last week, stressed dogs, anxious dogs will
Yes.
lick their feet,
Yeah.
often raw. So addressing underlying stress factors and underlying anxious dogs is another way that you can stop these hot spots and things coming back. And then
Yeah.
addressing poor skin and
Yeah.
coat barrier health, making sure that those things are not, the coat's not dry, it's not overly itchy, your dog doesn't have an essential fatty acid deficiency,
Yeah.
there's no sort of triggers on the skin that you put the dog in the right conditions and then they just start to itch.
Yeah, it's all feeling like it goes hand in hand, like stressed dog, itchy, creates hotspot issue, not balanced diet, getting the gut right, getting their skin in nice and just gotta have the perfect optimum, you know? Being a pet owner is no easy feat when you start opening a can of worms if you've got issues going on. I guess
Mm.
what we also talk about is how can we heal a hotspot? Like, can I do that at home? I know you've got an awesome product as well that we could talk about. Yeah, do we let it open? Like, is it like let the wound breathe? What's the idea?
Well, there's three levels really, and
Yep,
absolutely, if you get it soon enough, you can treat it at home. Not
yep,
all wet eczemas or hotspots need to be treated with antibiotics and steroids.
yep.
And there's actually a school of thought, there's actually a real reason not to. In the very, very high end veterinary, very severe, acute, rapidly necrotizing dermatitis, then fair enough, some of those, because those dogs are in quite a huge amount of distress. But anytime you use steroids in a dog, you actually unwittingly suppress their immune system. You can make them more likely to become diabetic. You
Mm,
upset their gut microbiome, but you also set them up for, long-term effects of steroids. So if we can avoid those things, having a first aid kit at home is ideal. So I
yeah.
tend to love my dog owners to have those little wee sets of clippers,
Mm,
clip right around the hot spot, give
yeah.
yourself a good 5 centimetre margin from around the outside of the hot spot. Clean the wound off. There might be a lot of pus or debris or moisture sticky coming out of
Mm,
that wound. You can clean it with a saline solution. You can clean it with an antibacterial solution that your vet might give you. There's some natural products, obviously, that do that, but you want a clean surface. For some dogs, be very careful. You may need to muzzle them, and if that's the case, you may wish to
yeah.
seek veterinary help. But Pet Putty we use every day for treating these kinds of wounds. This is my research product. I've spent 15 years researching acute
Mm,
dermatitis in dogs, and I'm a published research scientist. So I really love to encourage people not to use antibiotics and steroids where appropriate, and treat topically with Pet Putty. So it's an
mm,
alkaline bentonite clay These bacteria hate being dried out. They want to be really moist. It'll go right around the wound. It's easy to apply at home. It's cooling. It's got local anesthetic properties, rapidly antibacterial. And for many of the minor superficial dermatitis, Pet Party is all you may need to do. So great to have in a first aid kit. Drying the skin surface, reapplying Pet Party just once a day is enough.
Yeah.
And it's also good if you've got an initiating factor of something like a prickle in there. Often the magnetic pull of the clay will actually pull a foreign body out of the skin, including I've had it pull out barley grasses from between dogs' toes.
Wow.
So it's really, really good to have at home. So that is Pet Putty. And I know that you stock that, Sammy. That should be a great first aid kit for anybody with a dog that keeps getting wet eczema.
Yeah, we do stock Pet Putty, and we're big users of Pet Putty. We love it, and we always advocate for it. My question is, asking for a friend because I'm a user as well, is how, because obviously it can be a bit messy, and like I've got a dog that likes to sleep on the couch and the bed.
Yes, yes.
What when I apply it, like, can I just
I'll
wrap a
show
little
you that.
bandage on it? How do I stop it going everywhere?
So what you want to do, it's a bentonite clay.
Yeah.
So you want to just take about that much off.
Yeah.
And then you're going to get your dog and you're going to do a square around the outside. Can you see that?
Oh, yeah.
Now what happens is clay magnetically attracts to clay. So when you put the big piece in the middle, you're then going to make Mount Vesuvius.
Cool.
And can you see that just sticks to itself? So you don't have to use heaps. Often people use too much and the weight of the clay will plop off.
Yeah.
But that's all you need to do. Now that will dry very quickly. Put your putty on, clip the dog's lead on, whip round the block, and by the time you get back, it's dry. Now dry clay doesn't get on your carpet, your furnishings, because it's a white clay. It will wash off with water, but nobody wants clay on their furnishings. So either pop your dog outside for 10, 15 minutes, but I really like them to have a walk because that helps with their mental health. So that's an easy way to apply clay. You can leave it on and leave the dog outside. Once it's dry, it's not going to get everywhere. You can just simply wash it off with water and it'll come straight off. And then you can reapply tomorrow to dry it all out again. So those hair loss areas, those sticky, moist areas, they've often, as I say, got a sticky discharge. This will just pull all of the bacteria, the pus, the blood, the goop, all into the clay, and then it's bound. And then you want to get rid of that clay because that's got all the goop in it, and then apply some new fresh stuff tomorrow.
That is perfect. Thank you for that informational how to apply, because I needed to see that 5 years ago because I've been doing it wrong.
The square around the outside is really
the square.
helpful.
I've been just smoothing over, so I need to square and in the middle.
Square and make a mountain, and then smooth the edges.
That's perfect. Yeah, because we love that. And then I guess, like, if all else fails, that's great to know. Yeah, like reapply, it draws it out, take it off, put it back on, keep extracting.
And very cool. So it's an exothermic reaction on the skin. So I often get people to try it on themselves, and as soon as you put Pet Putty on your skin, you'll think, oh, it's nice and cool. Hot, inflamed skin, really great. I've had a lot of dogs that have come from other places with clipper rash, and immediately we'll just bog the entire dog, and the dog's like, oh my goodness, that feels so much better. So it's a bit like being a little hippo and going hopping in a mud wallow.
Oh, how nice. I know.
That's how Pet Putty came about. I went to Africa, I watched all the animals with their itchy skin, and they all went and hopped in these mud wallows, and I thought, well, they're doing that for a reason.
Yes.
So then I looked at the clay and the mineral content that was in what I perceived was dirt, but it's not. It's so much more than that. Silica, oxide, all sorts of amazing metals in there, and it acts as a magnet, and that's why the animals go and get in these muddy wallows. They're treating their own parasites, fleas, lice. They're protecting their skin, and I thought, well, gosh, if we can do that for dogs, that's a great idea. But that's
so
where it came
interesting.
from.
Cool.
It came from Africa, from the Kruger National Park, from a vet watching all the animals.
That's the way most things start, doesn't it? Like looking at why are they doing that? What's the problem they're trying to solve? It's so cool. So I guess if I've got a hotspot dog, like how do I stop them from coming back? Like what's my best tips to like you've got a hotspot, you've cured it. How am I
Mm.
staying keeping it away?
Well, the number one thing is flea control.
Yeah,
So
absolutely.
I
Yeah.
really regular flea control and making sure that you treat the cat as well as the dog, even if
Yes,
you don't
both.
see you've got a flea. So that'll rule out your flea allergy or dermatitis. If your dog has allergies, you need to address the environmental allergies, the grass, the
Yeah.
pollen, the dust mites in the bedroom. Maybe think about not having your dog sleeping in the bedroom if that's
Yeah.
a thing for them.
Yeah.
Food sensitivities, obviously, the top five allergens for dog: corn, gluten, dairy, beef, and chicken.
Yeah.
Contact irritants, things like Persil, cold water surf, people's perfumes, those are often petrochemical based. Those can be quite itchy for dog skin. If your
Yeah.
dog has ear disease, addressing the ear disease and understanding that sometimes, we've talked about this before, the only symptom of atopy, an atopic or itchy dog, is that the ears get inflamed and red and then they'll itch a hot spot. If they're
Yeah.
going swimming, make sure your dog's really dry and doesn't have a
Yeah.
collar on that's rubbing. And then addressing pain, sources of pain. So tummy pain, hip pain, carpus pain, sciatica pain, back pain, arthritis. Those are the underlying reasons of why you've got to ask why the dog is licking. If they're continually licking at their feet, is it fungal? Is it bacterial? Do they have ringworm and nobody
Yeah.
bothered to check? Have they been eating a hedgehog and got ringworm from their
Yes. Yeah.
pickle? So those things are good to think about for people.
Totally. Okay, so yeah, so pretty much looking at the external factors and minimizing those, just like we've talked about in other things, stopping those moments, being on top of everything should in turn stop the reoccurring hotspots. So you've got to remove the external.
And then I think you guys stock those really cool blow up e-collars. Do you still have
Oh,
those?
we used to. No, we don't. No, we don't
Right.
anymore.
So e-collars are great and good to have
Yeah,
at home with your first aid kit because I got a couple of the ones you guys had and they were
yeah,
excellent. I like a good blow up e-collar, nice and comfy for the dog, not a
yeah.
sharp piece of plastic that's going to take out your legs.
Rub
And it
once
just
again.
rub and it just means that you can hopefully address this at home and get it
Totally.
quickly. Don't leave it to see how it goes. Often they get worse, unfortunately, not better. The
Yeah,
final
jump.
thing I wanted to talk about is just how we use food to
Yeah,
improve skin health. So,
absolutely.
again, food is medicine. Choose anti inflammatory foods, it will impact the dog's general immune system and their skin health. So, adding things like omega 3, omega 6 fatty acids, sardines, and salmon is really soothing to the skin as long as your dog does not accidentally have a fish allergy. So, if that makes them
Yeah.
worse, maybe think about getting that tested. I have had a dog that was allergic to fish in the last little while. Um, Quercetin containing foods are helpful. So I know that's in your product, your senior, that's the blueberries. That's
Yes,
in
yeah,
your Dog Daily Senior. Turmeric is anti-inflammatory,
yeah.
highly effective in
Love.
the dog,
Yeah,
drug-free pain relief. Also great if the dog has arthritis and is just generally their mobility is a bit stiff. That can
yeah,
be really, really helpful. Um, Apple and broccoli are really good for skin health. Diversifies the microbiome, antioxidant, which is super helpful.
yeah,
And then zinc rich foods. So, not that you'd be wanting, I mean, deep sea groper, if you please, is very high in zinc, as is kelp, and that is in your Doggy Daily product. So, those things, a natural approach should always complement what you're doing medically for wet eczema, but the
yeah.
more you do in preparation, the quicker you act with your first aid may save you a visit to the vet with a really painful, awful, erosive skin lesion that lasts for, gosh, sometimes a week, 10 days more. Terrible.
Yeah.
Many of these dogs, we have to sedate them when they come to the
Wow.
vet clinic because they are just beside themselves with pain and they do not want to have those lesions clipped. It just hurts too much.
Yeah.
So
Oh, you can
with local
imagine.
anaesthetic, sedate
Yeah.
them, and then when they're having a nice gentle nap, then we treat them medically.
Yeah. Oh, no, yeah, you can imagine. It would be horrific for them. Like it's gotten bigger, bigger. You try to get into the vet, you get there finally. They've licked it 1,000 times, it's infected. So yeah, it's
Mm.
so useful to have that home first aid kit and have the right tools in there so that you can start straight away. See if you can get on top of it. And then if not, seek vet advice. Those are all my questions wrapped up there, Heidi. So thank you so much.
You're very
And
welcome. I love talking about wet eczema because, as I say, it's been something I've studied for a really long time. And many vets in New Zealand, we're all trying not to use antibiotics now,
yeah,
being directed by the NZVA because we understand the price that we pay. It's a bit like Russian roulette. Sometimes you have to use antibiotics if you've got meningitis or deep bone
yeah,
infection or terrible skin disease, but we must look after the gut and repopulate, regrow back that microbiome diversity using probiotics because otherwise we can wipe out these dogs' immune system. 90% of their overall immune system resides within the gut. So if you're not addressing this dog's skin health, they keep getting wet eczema and you're
yeah,
doing your very best, but you're giving steroids and antibiotics, your dog's immune system is going to be in the floor. So,
absolutely.
really, really important to talk to a holistic vet, talk to someone that's got lots of experience treating skin disease naturally, holistically, and from a really wide point of view so that you don't end up on the treadmill of continually
Yeah,
having your dog suffer and just you get quite frustrated. I've seen people that have been to many vets for, the same treatment and they didn't realise that the underlying ear disease had to be addressed or it was going to keep happening. So really encourage people just to think of food as medicine, do the basics, have a first aid kit at
yeah,
home and seek veterinary advice early, quickly. And
absolutely.
that will minimise pain and suffering for your dog.
I know. I think the key takeaway as well is, and we keep coming back to this, is food is medicine. So start well, continue, feed consistently,
Mm-hmm.
and hopefully you don't have these other reoccurring issues that sort of come from that base not being sorted. Okay, awesome. Well, thank you so much.
You're
And then
welcome.
we'll see you again next week.
Yeah, look forward to it. Thanks,
All right.
Sammy.
See
Okay,
ya.
bye.